Hey, boo, hey. How are y'all doing today? Ooh, I'm gonna give y'all some time to get in where you fit in. Ooh. How y'all doing? Hey, Tiffany, how you doing? How are you in your new edition? All right, guys. All right, so if you are here for part 3 of our NCLEX Maternity /OB review, okay? Part 2 was yesterday, part 1 was Monday. Happy hump day. How y'all doing today? How's your week been so far? It's okay. We're halfway through it. But let me know, drop your names and where you're from. Hello. All right. And also let me know if you've been here for parts 1 or 2. Let me know if you've been a part of the gang since the beginning. All right, guys. The topics for today. Oh, just in case we have some new people here. Hello. My name is Nurse Sam. I am a licensed practical nurse. Also, I am the CEO and founder of Nurse Sam Global Media, where I help nursing students, RN and LPN, just like you, get in school, through school, out of school, take the NCLEX, pass it to become amazing nurses. Okay? I'm a visual learner myself, and I create study guides and other resources for visual learners that just need a little bit more than just reading the textbook, okay? I like to be entertained when I study. It actually helps you retain more, all right? The more you are entertained, the more you retain. It's a fact. It is a scientific fact. Okay, so that is why I am here, to help you guys get a hold of this overwhelming information and to just give you guys the cheat codes. All right, so we have some people from Michigan. Hey, Rebecca from New York, South Carolina, Michigan, Baltimore. Awesome. Hello. Joining me. I'm from Fort Lauderdale in Florida, but I am currently in ATL. Hey, Sweet Persuasion, I'm at ATL too. Miss Hollywood, New York, that's funny. Green Eyes, California. Awesome sauce. New Orleans. Ooh, I need to go. I need some crawfish, Lord. From Michigan, just started LPN school today. Ooh, congratulations. Awesome. All right, so let me go ahead and get here and get to the good stuff. All right, guys. So yesterday we did the stages of labor. We did fetal heart rate, and we did, I forgot what else. No signs of pregnancy was the first one. And we did pregnancy complications. Hello. Today we are going to be doing postpartum complications, postpartum assessment, newborn assessment, and common maternity meds. Okay? So can you please elaborate on the subscription? Sure, you get all replays, including these replays, all the replays from NCLEX Jeopardy and Tuesdays. You'll get weekly NCLEX Jeopardy questions. That's just for subscriber only. So you'll have like your daily NCLEX questions a day. But the big main thing is the replays. All right. Unless y'all just want to come live, of course, hello. We're always going to save these lives. You guys are free and welcome to join me when I'm actually like live. But if you guys want to catch the replays and have forever like access to the replays, subscriber only. Okay. There are some NCLEX Jeopardies on my YouTube, so you can get a taste of it, see how it is. But we have it live for free all the time But like I said, if you can't do the lives, or if you can do lives and you just want the replay, says go ahead and subscribe. It's only $2.99 a month. Okay. Wait, hold on. All right. So let me go ahead. I need the maternity med review, especially for oxytocin. Oh yeah. Awesome. All right. So let me go ahead and bring it up. Now I'm always going to say, if you guys are registered for our back to school campaign that we are in week 4. This is maternity. All right. Like I told them, hopefully you guys are, some of them that have signed up for it. Your newsletters kind of let you know a breakdown of all the topics that you guys need to touch on. But I just decided that I wanted to help you guys and assist you guys with understanding and comprehending that content by just going live with you guys every day for this week. Someone said, so mad I missed med-surg. I'm gonna be doing these, not these questions or these, I'm gonna be doing these classes again, these courses again. Like, because before we did like fundamentals farm. So I'm just kind of going through it. But that's why I have you guys vote on it. But yeah, so as far as the newsletter goes, you get that when you sign up. And if you signed up previously, you also got it in your email. Is there a way I can go back and watch? Yes. If you do. I believe that's in my subscriptions, but I'm going to make sure. I'm going to make sure it's in the subscription only live. But yes, so like I said, today we're going to do some assessments. If you guys, let me know this. If you guys have, I'm not sure if any of you guys have any of my bundles or my starter kits. Hopefully all of you guys have them. All right, this is our Nurse Bucks. This is our assessment / clinical report sheet. I personally made this really for me when I was at work because I just needed a cool, fun way to actually give report, receive report, and have all my information like right here on one page and one sheet. But it's also really good for clinicals. I would give the nursing students that was there these papers because I had a bunch of them already printed out, and they just loved getting it, and all the providers loved it. The nursing students loved it, and the clinical preceptors loved it. So this is available in, I think, like all my bundles, first, second, third, and the Ultimate Nursing School bundle. And it's also available within the study workbook, which is free. Okay, so this is still a free download. This one sheet is still a free download. It's within the study workbook. Okay, so just know that. But yes, so when we're doing our assessments, you can use this as a guide, okay? But specifically for labor and delivery / mother baby, this is going to have everything that you need. This is really more so for like med-surg and like fundamentals. But for postpartum assessments and newborn assessments, you have special assessments and that you need to do. All right, special categories, I guess, that you can say that you definitely need to check off for your mother baby. Okay, that's not going to be on here. It's specific to labor and delivery, specific to mother baby. So we're going to go over those. We're also going to go over not pregnancy complications, but postpartum complications and those common maternity drugs. Now, if you guys have that newsletter, you should have, I thought I printed it, but you should have received the, under homework assignment number 2, it says create a drug. That's our create a drug card. I'm sorry, that's our activity for this week. You're supposed to do a maternity pop quiz and then the create a drug activity. Create a drug card activity. All right, you're supposed to use our drug card template, our study template, and create a drug card, just one drug card from any medication at all. I saw someone earlier today said that they were struggling with oxytocin. Perfect. You should do that on your med, okay? For your activity, that should be your medication of choice, oxytocin. All right, so we're going to go through all that stuff. If you don't have the maternity study kit, you need to get it. We're going to kind of go through some of the things that's detailed within the study kit. But if you, like I said, want the actual details, make sure you invest in the study kit, which is included in the 3rd semester bundle and the ultimate semester bundle. All right, so let's go ahead and get started. Okay. So we left off at fetal heart rate pattern and contractions. If you guys were not here for yesterday's review, I guess my 2 posts ago, the one that's veal chop, that can be like a good summary right there. That was a really big part of yesterday's live. 4 stages of labor, and also like the veal chop / the fetal heart rate tones. So make sure you save that post, like that post. You're going to need it for later. Okay? All right, so let's go ahead and get into postpartum nursing care. Now, as far as what you need to study and what you need to pay attention to within postpartum care, that is definitely, make sure you pay attention to what's normal / abnormal. Do you always go live at 7? Usually. Yeah, usually. I usually go live at 7. That seems to be a good, sweet spot time for you guys. So I usually go live at 7. But yes, as far as postpartum care, as a nurse, as a labor and delivery nurse, all right, it's going to be your job to be able to recognize what's normal versus abnormal, okay? And we'll get into what the specific changes for postpartum, okay? We talked about this yesterday, but as far as postpartum, the lochia that we talked about, the 3 different shades of red, that's basically measuring the bleeding, the postpartum bleeding. Okay, it's called lochia, Lochia. There's 3 types. You got to know what is abnormal versus what's normal bleeding for that time frame. Okay, so I'm just going to review it very quickly because that is very important to postpartum care. This is review for both RN and LPN. You both got to know it. It's going to be on both y'all NCLEX. Okay. Yes, so the lochia, there's 3 types. Lochia rubra. All right, that's kind of like when you think of rubra, think of ruby. All right, that lasts 3 to 4 days. The other type is lochia serosa. All right, that's a brownish pink color. Lasts 4 to 10 days postpartum. And then lochia alba, that is a whitish yellow. When I think about alba, I think about albino, kind of like a whitish type thing. That's 10 to 28 days. Okay, so you'll, for example, you'll get a question that's telling you what's happening as far as it's going to describe the postpartum bleeding. They're most likely going to say, okay, it's the 11th day postpartum, and the client is still experiencing, when you look in the client's, when you ask the client what kind of bleeding they're having, they're still reporting dark red blood. It's up to you to know that on the 11th day, they should not still be having that dark red postpartum bleeding. They should be having, it should be in its whitish yellowish phase, the lochia alba. All right, if it's not that phase and it's still at dark red, it could be a sign for hemorrhage. All right, you got to know that. You also need to know the interventions for that as well. Okay. Thank you, Nurse Nell. So that's the types of lochia. You definitely need to know that postpartum. All right. Second, you also need to know about breastfeeding. Breastfeeding care and the complications with breastfeeding, just in case they have some problems like latching. You need to know, especially for like patient teaching, you definitely need to know, once again, what's normal, what's safe for both mother and baby. All right. One of the big things, I'm going to say this every day, but one of the big things for studying maternity nursing is to realize and understand that you don't just have one patient, you have 2. So your interventions have to be for the safety of both mother and baby. Okay? So this sounds like a simple concept, but it's the only specialty within nursing where you have to focus on 2 people. Okay, so it can seem like, oh, okay, but don't let it get you got, okay? Another thing, which you, as far as that data collection and assessment, as far as postpartum, you want to remember the acronym BUBBLE HE, okay? BUBBLE HE. Bubble HE. All right, that is going to be your mnemonic for, well, yeah, your acronym mnemonic for postpartum assessment. Okay. So let's role play. Okay. So let's say we have a client that just delivered. Okay. She's postpartum at this point. These are the bubble HE is going to let you know kind of the things that you have to hit on that's specific to this postpartum assessment. All right. So the first letter, the first B in bubble, that's for breast. Okay. You want to do your breast exam. U is for uterus. All right. You want to make special note and pay special attention to the fundal height, the uterine placement, and the consistency. Okay, yesterday we talked about whether or not the uterus was like boggy or not. You'll hear that term a lot within maternity nursing. When you hear that a uterus is boggy, that means that it's a tender, firm, not soft to touch. That's a boggy uterus, and that's abnormal. You don't want somebody to describe your uterus as boggy. Okay. So yes, that is what would be assessed during postpartum care. All right, so we have breast, uterus, then we have bowel and GI function as one line. Bowel and GI. Okay, the next B will be for bladder. All right, and then the L, we just talked about this, the lochia. Remember, there's the three types of lochia, and it needs to be consistent with, the color needs to be consistent with the time frame postpartum, okay? So like I said, it's up to you to note that. You got to note the color. You got to note if there's an odor, especially, let me not say what I was going to say. Note the color, note the odor, the consistency, and obviously the amount, okay? And then the E for bubble stands for episiotomy. All right. Is there any edema, ecchymosis, which means bruise? Okay. And the approximation of those like edges within that episiotomy. You know, episiotomy is when they like cut that piece of, what is an episiotomy? Like, what's the actual term for it? Like definition. Episiotomy. Okay, it's the incision, but the perineum. All right. What was H? H was, oh, we didn't get there yet. We just stopped at bubble. We didn't get to he yet. All right, so next thing after the last E in bubble, which is for, or there's only one E in bubble, which is for the episiotomy, remember? The next thing after that is Holman sign. Okay? Holman sign. Holman sign is a test, like a type of test where you assess for DVTs, all right, deep vein thrombosis. So one of the very common pregnancy complication, especially amongst Black women, is after giving birth, they experience DVTs, deep vein thrombosis. That goes to your heart, have a heart attack, goes to your brain, have a stroke. Okay, so Holman sign is the test that that assesses for the presence of DVTs. Okay, so if in a Holman's test, if it's positive, then that is that's abnormal. All right, and it's positive if they experience like pain when you like manipulate their leg a certain way. Like if you it's actually forced dorsiflexion of the foot. All right, so the knee has to be straight, all right, and then dorsiflexion of that foot. And if it's pain, then that lets you know there's some that there's a possible DVT. There, it's positive, all right? If there is no pain, it's negative. You want the Holman's test to be negative, okay? Positive means it is positively bad, it's abnormal, and then negative means it's normal, okay? All right, so that's Holman's sign, that's the H, and then the E is emotional status, okay? Miss Mama's done pushed out this 8-pound baby, hormones all over the place. We got to assess that emotional status to make sure there's not some like postpartum depression going on, psychosis, all those real stuff, because hormones are not to be played with. Hormones have hands. Hormones have hands, okay? So assessing emotional status is actually very important to both, once again, mother and baby. All right. That was Bubble He. All right, for our assessment. Now, what I do want to touch on though is thermoregulation, just really quick. And I don't know how many of you guys have to take ATI, like ATI tests in between your program. Let me know if you do. Do you have to, after every like course, you have to take like the actual school exam, but then you have to, in order to like graduate out or go to the next semester, you have to actually take an ATI assessment or take an ATI exam for that course. Like we had to do an ATI for fundamentals, ATI for farm, ATI for maternity. Did y'all have that? Or do y'all have that? Oh, that sucks. I know. I think, is that for everybody? I'm not sure. But just so y'all know, I don't know if your program gives you like the actual ATI books for you to, proctor exam, that's what it's called. I don't know if your program gives you the books or if you guys have to just purchase those yourself. But if you have to take these ATI exams, what I will say is how you study for these ATI exams is not how you study for your nursing programs exams. The ATI one is just a little bit more, it resembles the NCLEX just a little bit more, but I will say that ATI is like a world of its own. Yeah, ATI is definitely a world of its own. So if you have the books, I would definitely read the books for the ATI test. Okay, you can also use it to like help you to reinforce your notes and your studies for your actual nursing program like test. But for ATI, I would stick with ATI. They have a specific style of testing. I'll just say that they have a specific style of testing. I can't really explain it more. Like once you start taking it, you'll be like, oh shit, yeah. Like it's on its own little island. But if you're taking ATI, just stick with the ATI stuff. Like I said, you can use that to supplement your studies for either your NCLEX, exit HESI or whatever, and your semester exams. Okay, but sometimes there's some stuff that's covered in ATI that's not covered in other places. So that's why I said use this one for this. Okay, but just in case you see this, I remember having this particular question or something about it on mine, and I don't remember seeing it. Me personally, I don't remember seeing it anywhere in my textbook. Or if I did, we didn't spend too much time on it within lecture. That was not stressed, nothing. So, like I said, whenever I get got once, it's very hard to get me again, especially with a question. I'm that competitive. I'm a Scorpio through and through. Okay, once you get me once, that's it. That is it. So if I got got, I want to make sure y'all don't get got as well. Okay, so do y'all know about the postpartum chill? I don't know. But postpartum chill, okay? That actually occurs in the first 2 hours periperium. Does it say postpartum? I think that's supposed to say postpartum. Yeah. It occurs in the first 2 hours postpartum, and it's an uncontrollable shake. that's experienced by, it's like a shaking chill, like the real, like the shakes, that's experienced by clients immediately following birth, okay? It's possibly related to a nervous system response, vasomotor changes, a shift in fluids, and or just the work of labor. This is a normal occurrence. Okay, unless it's accompanied by clinical manifestations that support like an infection, like elevated temperature, heat, redness, to the local area, then that's a little bit different. But just in normal circumstances after birth, the uncontrollable shakes is actually a normal occurrence. Me personally, I've never had kids, never will have kids, like actual labor, never be pregnant. And I was like, I've never heard about this before. And I surely did get that question wrong. It was like, select all that apply. Like, which one would cause for concern, or which one would you expect within the first hour or two after birth? And that one was just, someone said legs shaking like a stripper. Oh Lord. I had that. It was the worst experience than my first daughter. It was so cold I couldn't control it. Yeah, I've never heard about that before until I actually read that within the ATI book. But I did not see nothing about that anywhere else. So I just wanted to just give you that little ticket, little token, so you guys can take that and do with it as you will. Okay. Nursing intervention for the postpartum chill. Okay. Postpartum and Netflix chill, whatever, is warm blankets and warm fluids. All right. All right. This is also important. Postpartum. We're talking about postpartum, after delivery of baby and placenta. Okay. Your fundus. Okay. It says physical changes of the uterus include involution of the uterus, which occurs with contractions of the uterine smooth muscle, and that helps it return to its pre-pregnant state. Okay. This is very important because there's going to be a question that asks you after, how long will it take, or how long should it take your uterus to revert back to pre-pregnancy size? And the answer to that, well, it's a few answers to that. So I'm gonna let you guys, I'm gonna read this to you guys. Okay. It says that the uterus rapidly decreases in size from approximately 1,000 grams to 50 to 60 grams over a period of 6 weeks, with the fundal height steadily descending into the pelvis approximately 1 centimeter per day. Okay, so very important. It says immediately after delivery. Note this, all right? Because please note this. When they're talking about postpartum, make sure you pay close attention to the time frame that they're telling you. Okay, if they're telling you it's 1 hour postpartum, if they're telling you it's 2 hours postpartum, if they're telling you it's 3 weeks postpartum, pay attention to that. That's more than likely, within maternity at least, it's going to be important. But it says immediately after delivery, the fundus should be firm, midline with the umbilicus, and approximately at the level of the umbilicus. Okay, at 12 hours postpartum, so 12 hours later, the fundus may be palpated at 1 centimeter above the umbilicus. Okay, it says every 24 hours, the fundus should descend approximately 1 to 2 centimeters. Okay, every 24 hours postpartum, the fundus should descend approximately, 1 centimeter a day, 1 to 2 centimeters a day. It should descend every 24 hours. 1 centimeter to 2 centimeters every 24 hours. It said it should be halfway between the symphysis pubis and the umbilicus by the 6th postpartum day. All right, so make sure you look at fundal height and pay close attention to fundal height. What's normal versus abnormal. Remember that. Okay. And then it says by day 10, the uterus should lie within the true pelvis and it should not be able to be palpated at all. It should not be palpable by day 10. Okay. Remember, as far as like that fundus, we're assessing for whether the fundus is firm or boggy. Remember I said we're describing like whether or not it is like firm or not firm or soft. If the fundus is boggy, make sure you know your interventions, all right? Boggy means not firm. I don't know why, but to me, boggy rhymes with soggy, which helps me remember that the boggy is not bad. It's not firm, which means it's not where you want it to be. But yes, if you have a fundus boggy, what you want to do is massage it. I was going to ask y'all, but I'm not sure if y'all know. If you have a boggy fundus, you want to lightly massage the fundus, okay, in a circular motion. All right. Now let's slightly touch on medications, because what I want to talk about is medications specifically used during labor, because during your postpartum assessment, if your client was on these specific meds, you definitely want to monitor for side effects or monitor for any like residual effects from these specific meds. Okay, you want to include that in your postpartum assessment. Okay. Wait for it. Okay, here we go. Common maternity meds. All right, so when it comes to medications for your postpartum patients, really for maternity period, but let's specifically talk about postpartum. Pain relief. Remember, pain is the 5th vital sign and it's subjective. So if she says that her pain is on a scale of 1 to 10, it's a 72, you got to put 72. Any quotes, you literally have to put exactly what they say. You know, in addition to asking them to describe it and do a pain assessment test and all that good stuff. Depending on what they say, there's specific medications that's normally used within labor and delivery. Let's go ahead and get into, like I said, for pain relief. You usually have like your fentanyl, your morphine sulfate, your Dilaudid. That's when people be like, oh, I want the one that start with a D. That's Dilaudid. Percocet, Molly, Percocet. Minus the Molly, okay? So fentanyl, morphine, Dilaudid, Percocet, like you are pushing out a human, okay? Tylenol, codeine number 3 will not work for me. It will not work. Please do not ibuprofen 800 me. Please do not ibuprofen 800 your patient immediately after delivery. All right, read the room. Read the room. As far as their pain goes, please make your proper assessments. Do not put your personal opinions, whether or not you did it naturally, so you feel like every other woman should do it naturally and suck it up. It don't hurt that bad. And if they say it hurts. So do your part and just make sure that you are recording the pain, assessing the pain, relaying that information to the provider so that it can then be, her pain can be relieved. Okay, with either pharmacological or non-pharmacological interventions, meds or not meds. All right. Now, as far as, you know, let's say they have like an episiotomy or something like that, or maybe they had a few tears and it's been like 2 weeks. Once again, assess pain, but then that's when like the ibuprofens would come in. You know, you gotta assess the pain and make sure that it like matches the time frame. Immediately after delivery, you would probably go for one of the stronger like opioid medications for like maybe like just, I wouldn't say everyday wear and tear, but just for some aches and pains, maybe a few weeks down the road, especially because she's breastfeeding, then most likely like Motrin or something a little bit milder, like an NSAID. All right. Usually Phenergan is given for like anti-nausea. It's an antiemetic. And then you want to look into the actual medications that are, that can reverse some of that. So let's say, for example, somebody is taking, maybe fentanyl or Dilaudid or something like that, and they get just a little touch too much, just a little bit lost in that sauce. They're going to have to get a reversal agent. And can anybody tell me what the reversal agent for fentanyl is? Or just an opioid. What's our reversal agent for narcotics? Narcan. Absolutely. So make sure that's always on hand. Okay. Prenatal vitamins with folic acid. Remember, folic acid is very important, especially prenatally. Okay. The medication, you'll probably hear this a lot. All right, when you hear maternity, I want you to think about magnesium. Magnesium sulfate. Right, naloxone, Narcan. Narcan's you're right. On the NCLEX, you're only going to see meds via their generic name. We're not going to see it by their brand name. So Narcan's the brand name. Naloxone is the generic. Personally, I suggest you learn both, but like we said, for the actual NCLEX, it's gonna be generic, not brand. Okay, but when you get into the real nursing world, you're gonna refer to those medications by their brand name, usually because you're doing patient education and it's easier for you and that patient to say and understand. So just learn both. So we talked about magnesium. Well, I just mentioned magnesium sulfate. All right. So that is an anticonvulsant, and it's also used as a saline laxative. Okay. But what it does is that it treats pregnancy-induced hypertension. Okay. So if I say that magnesium sulfate treats pregnancy-induced hypertension, you would think that this medication would be used if a client is having what pregnancy complication? If magnesium sulfate is used to treat pregnancy-induced hypertension, what pregnancy complication that features pregnancy-induced hypertension would you expect for this medication to be like prescribed in? Specific to pregnant women. When you think of pregnancy-induced hypertension, thank you, sweet persuasion, preeclampsia, absolutely. Okay, because once again, the three major signs and clinical manifestations of preeclampsia. Remember, you want to remember PIE, proteinuria, which is protein in the urine. I for increased blood pressure, hypertension. Okay, and then the E is for edema, specifically. Okay, around like the in the face, but specifically around the eyes. Periorbital edema is the type of edema that you'll expect to see. You also see it in your hands, but there. That's going to be the type of edema specific to preeclampsia. So magnesium sulfate is a medication that you can expect to see. All right. Now, when it comes to magnesium sulfate, there's what you want to be wary of, or what you want to be aware of, is the risk of toxicity. Okay. Magnesium sulfate toxicity has a specific, specifically it has a, how do I want to say this? Certain signs and symptoms, like any other toxicity, but it has certain signs, symptoms, and like manifestations to let you know, oh, maybe I'm giving a little bit too much, or maybe this patient has had a little bit too much magnesium sulfate. It's starting to get to the toxic side. All right. You want to remember the mnemonic burp, B-U-R-P, burp. Okay. The B stands for BP decrease. So hypotension, that BP goes down. Okay. Remember, magnesium sulfate, the indication is to treat pregnancy-induced hypertension. So the mechanism of action for this, for magnesium sulfate, it's supposed to bring your blood pressure down. But like with anything, when we have too much of a good thing, it can be a bad thing. All right. A risk, adverse effect of anything that makes blood pressure go down is that it can make it go down too much. Hypotension, which can cause falls, which can cause injury, which is not what NCLEX wants you to do, or just the world, period. But remember, specifically for NCLEX. Okay, so mag sulfate toxicity, aka a little bit too much magnesium sulfate within the system. You're going to get that BP to decrease too low, even more low than we wanted. Okay, so burp, BP decrease. The U stands for urine output decrease. Okay, so we're not urinating as much, so we have something going on with our kidneys. Okay, R is respiratory rate decrease. A lot's decreasing. And then P is for patellar reflex absent. All right. When I say patella, what does that mean? What is that the anatomical term for? Patella. And what body part am I talking about for when I say patella? Patella. NC Pink Rose. Absolutely. Yes. Thank you, Sweet Precision. Thank you, Maylene, Chrissy J, Momo, the kneecap. All right. So if they're saying patellar reflex absent, I know y'all have watched at least one movie or show when they talk where they're showing like doctor stuff, and they take the reflex hammer and boop on the knee, and then the knee go like that. Even if you haven't watched anything, if you've had one physical, if you went to the pediatrician once, you've seen it, right? Right? No judgment if you haven't, but that's what a patellar reflex is, okay? So if you're, if they hit that patellar, or if they're trying to elicit that patellar response, they're going to hit that kneecap with that reflex hammer, and then the leg's going to kind of like shoot up, like jerk up. That's a positive response, all right? The patellar reflex is very, very much so intact, observed and intact. Now, if it's absent, if they hit that thing and nothing happens, that's not good, okay? Now, another thing. Ooh, y'all, so we're going to be stair-step. This is critical thinking, y'all. This is critical thinking. All right, so magnesium sulfate, right? When you think of magnesium, what is magnesium, the actual electrolyte? Give me like one thing that it's like, give me one function of magnesium. Okay, where do you expect for magnesium to play a huge role in? Okay. Especially based off of the P in burp, meaning patellar reflex absent. Based on what we know from fundamentals, about those electrolytes, those fluids and electrolytes, based off that freebie that Nurse Sam got on her page right now. What do we know about magnesium? It plays a role in what? For torrid points and seizures. To relax seizures. Okay, so remember, magnesium's a very abundant cation within the body. Okay, and intracellular cation. It plays a role within like the nervous system. Torsades. I know what you meant. NC Pink Rose. I swear I know what you meant. Okay, hold on. Wait 1 second. Okay, I said treats preterm label. Yeah, that's magnesium sulfate, but I mean the actual electrolyte magnesium. All right, you typically see that. I would say it has like a. You'll see with anything that's like requiring like electrical energy. So like muscle contraction, that's a really big one. So that's why uterine contraction, right? Uterus is a muscle. Okay, magnesium sulfate plays a role in that as well. Okay, go back to it. Am I making sense? Am I making sense? Where is my little thing? Right here. Okay, so yes, magnesium sulfate toxicity, burp, BP decrease, urine output decrease, respiratory rate decrease, and patellar reflex absent. All right, the antidote, this is very important as well. The antidote to magnesium sulfate toxicity is calcium gluconate. All right, if magnesium sulfate toxicity is suspected, then the antidote that would be then given would be calcium gluconate. All right. Now, whenever they're giving these medications, especially like via IV, to do whatever for labor. Okay, we're going to get into some of those. There's certain medications that are used to help speed up labor and to help stop labor. Okay, but like I said before, if you have too much of a good thing, it can be a bad thing. So too much of either of those medications can cause, a disruption in that homeostasis, and it can either super stop the labor or super speed it up. Okay, so whenever you have something like that where it's like toxicity, given too much, one of the first interventions that you have to be mindful of, especially choice-wise, is you have to stop the infusion. Okay, always remember your ABCs: airway, breathing, circulation. But when you're doing like interventions as far as what you should do next, make sure that stopping that infusion of whatever medication is on that list. Okay, because you can do all the interventions you want, but if you're continuing to give that medication that's causing the problem, that problem is going to snowball. Okay, so speaking of magnesium sulfate, the medications that are used the medication that's used to stimulate contractions. All right, so let's say, I don't know how to say it. You have a client where you need to stimulate those contractions. We got to get it going. This medication would be given. This medication is called methergine. All right, methergines. It also controls bleeding. Okay, but methergine is known to stimulate contractions. So that's one of the medications that would be given to accelerate contractions / labor. Okay. Was there anything specific about that I had to say? Other than that, I don't think so. Okay. Now, oxytocin. Where's our oxytocin? Right here. That is a bonding hormone, oxytocin. All right. Where else do we see oxytocin? Do y'all know? Oxytocin is also a hormone, correct? Oxytocin does the same as what? Oh, does the same as stimulate uterine contractions? It does. Right. Right now we're on medications that stimulate contractions. And the first one was methergine. Second one is oxytocin, right? Yes, Chrissy, as the same thing as methergine. Now, oxytocin is also a hormone from the pituitary gland. Okay, I don't know if y'all have taken endocrine yet, but yes, that's also where you see oxytocin come up. Okay, that is another thing that induces labor. Let me see. Wait, hold on. What was the E you mentioned for preeclampsia signs and symptoms? Oh, edema. So periorbital edema, and then I put next to it like parentheses periorbital / hands. Okay, but mainly periorbital. All right. So yes, so oxytocin does the same thing as methergine, which is stimulates contractions and induces labor. Now, when it comes with oxytocin, just like I said, you can have too much of it. So if that oxytocin starts to be like a little bit too much, which definitely happens, and that's actually one of the that's a very important like nursing intervention, nursing education for both the nurse and the patient. Letting them know if you start to feel, any type of way, these specific ways, let me know. All right. There was something specific I want to tell you about oxytocin. All right. Another name for oxytocin is Pitocin. Okay. Definitely remember that. Yeah. I think that was all I needed to say about Pitocin. But that's the main one that I was talking about when I say when I was talking about fetal heart rate tones. Remember with veal chop, okay, depending on those fetal heart rate patterns, which can be decelerations or an acceleration. Acceleration is fine. Then you have 3 decelerations: variable, early, and late. Okay. Of the 3, late is definitely the worst one, and then variables, that one's not the best, but the lesser of those evils is definitely early. It's better to be early than late, say that. But if you have late decelerations, or if you note late decelerations within the fetal heart rate pattern on the monitor, then you have to assess and kind of jump into action. All right, depending on what the actual cause is, you have certain interventions that you need to do. Does anybody? I just posted it yesterday. I don't know if y'all know, but you want to think about how did I say? It was coin, I believe it was coin. You want to change the position of the client, of the pregnant mom. And you want to change, as far as their position, you want to put them on the left side or Transdellenberg, like knee chest. Then you want to, that O is either add oxygen to oxygenate both the mom, which oxygenates the baby, and turn oxytocin off. Okay, so remember I told you guys, whenever you have problems where it's getting a little bit too much, whether you note MAG's toxicity or too much Pitocin, that's when you want to definitely stop that drip to stop further effects of that medication. So just know that. That's a specific thing that I definitely want to let y'all know. Okay. What else? Now, a contraction antagonist, or so a medication that will stop contractions temporarily. Okay, sorry. But yeah, medication that can stop contractions temporarily is called terbutaline sulfate. Okay? Not to be confused with magnesium sulfate. All right? Terbutaline turns it off. That stops contractions. Now, as far as medications to relax the uterus, like I said, we just talked about the one of them, which was terbutaline, that counteracts contractions, so that stops it. Something else, other meds that relax the uterus is indomethacin, which is a non-steroidal anti-inflammatory drug, or an NSAID. Nifedipine, which based on I won't go there. Nifedipine, okay, which is a calcium channel blocker. I was going to ask you what kind of med it was. Terbutaline, we just talked about it. And then, once again, magnesium sulfate. Those are meds given to relax the uterus. Okay, now, before labor, right? Before labor can actually begin, or before while the body, or the mom's body is actually getting the body ready for labor, the cervix has to ripen. Sometimes medications are given to help speed that process along, and one of the main medications that's given to ripen the cervix is called dinoprostone. 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 Dinoprostone, that ripens the cervix. Okay, gets it nice and ripe and ready for this baby to push on through. Okay. Another thing that you need to know. Prostaglandin what? Is that on my list? Tell me prostaglandin what? I'm not sure what you're about to say. All right. Rogam. Y'all know about Rogam? Oh, prostaglandin to ripen the cervix. Rogam. All right. You're supposed to give Rogam. Do you know at a specific point in time, at X amount of weeks? Do y'all know? You're supposed to give Rogam at blank number of weeks if the mother is Rh negative and if the fetus is Rh positive. Or you give it after, like, trauma bleeding. Okay, 28 weeks. Okay. I'm the ambitious one and Bella. Okay. That's what I love to see. 28 weeks. Okay, Super Session came up with and also 72 hours after birth. Oh, that's what I love to see. That's what I'm talking about. Okay. All right, so let's get off of mom for a second. I got my notes tonight, period. Let's get off of mom for a second and let's get into the newborn. Okay, there's some medications, some drugs that the newborn will get, especially immediately after birth. Okay, one of them being erythromycin ointment. Okay, erythromycin ointment. That's usually given if the child has been exposed to what? And it's erythromycin ointment, and they put it on the eyes to prevent blindness. But from what? Do y'all know? They may also ask this question like in reverse as well. I say, girl, I'm stressed. All right, so erythromycin ointment is applied in newborn eyes or on newborn eyes to prevent blindness related to chlamydia. Okay, NC Pink Rose and Liz the nurse gonorrhea. GC chlamydia. Yeah, G in the C is gonorrhea / chlamydia. I was like, GC chlamydia. But yes, gonorrhea and chlamydia, absolutely. If mom has gonorrhea, chlamydia, and delivers vaginally, the newborn will get erythromycin ointment, like an antibiotic ointment, put on their eyes to prevent blindness related to the gonorrhea and chlamydia. Okay? Know that. Bella said, this is too good. Let me get my charger before my phone dies. Right. Something else. And I actually learned, I learned this from, it wasn't private practice. It was actually Grey's Anatomy. I'm actually going to upload that clip either today or tomorrow. Depends on where we are. But I actually learned this medication from Grey's Anatomy. Okay, I'll say this. All right, so steroids, right? Steroids are given to newborns, or even, I'll say this. Steroids, specifically betamethasone, which is a corticosteroid, all right? That's given to preterm preemies, all right, to help with what body part? Let me see if I'm saying that right. To help mature what body part? I'll say that. Okay, so let me say it. Ooh, okay, Bella. Okay, Bella in Sweet Persuasion for fetal lung development. Absolutely. Ooh wee. All right, great job to everyone that said lungs. Absolutely. All right, it helps mature lungs. Specifically, it helps with surfactant production. Okay, remember the surfactant within the lungs? Yeah, but it helps mature the lungs. All right, so that's important. So I remember saying that. Like what medication? It was specifically like, which medication would the nurse know to give to help mature a preterm baby's like lungs? It was something like that, and I had to I had to pick which one it was, and betamethasone was one. And they had the actual names of the medications. It wasn't like classes. So you want to give steroids to help mature the lungs. Remember, even if they don't have like, a steroid, remember your suffixes. Okay, your drug suffixes. Whenever you see like SONE, like a SONE, like ASONE or SONE, that signifies steroid. Okay, like hydrocortisone, steroid little rub thing. That's what I mean. Oh yes, I hope you're safe as well, NC Pink Rose. Tell Hurricane they're gonna have to see me. Okay. All right, so we talked about the erythromycin ointment. They also, newborns also get a shot. They get a shot of what? As prophylaxis to help wait, hold on, I don't want to give it away. Okay, they get a shot of what medication or what drug, whatever you want to call it. Okay, y'all can let me finish it. Y'all can let me finish it. They get a shot of vitamin K to promote clotting factor formation in the liver. Okay, vitamin K. All right. It's also called aqua methyon, MEPHYON. So just in case. But yes, it's a vitamin K injection to help clotting factors, well, to help promote clotting factors to form. Okay. Okay, y'all are on it. Did y'all take y'all study gummies? Y'all know it's back. Y'all must have took y'all study gummies today. I'm so proud. All right. All right, so we talked about that. We talked about that. Ooh, we talked about... I'm like a proud mama. Looks like everyone's ready for today's class ahead of the game. Okay. I love it. Okay, those were the main things that you needed to know about the commonly tested medications on maternity. Now, with that being said, you take any one of those medications that we went over and pick one of those to do your drug card activity. Okay, so remember your NCLEX, not NCLEX, but your newsletter that you get after you signed up for week 4, that was emailed to you if you signed up before, or directly emailed to you if you signed up during week 4. That newsletter, that second bullet point under homework assignments. Let me see if I can bring it up. Let me see if I could bring it up. Okay, I can't find it, and that's fine. No, I'm gonna find it, and it's coming up in like 2 seconds. 3, 2, 3, 2. Okay, here we go. All right. So this is the newsletter, but just like really blown up, so I apologize. But write down here, number 2 under homework assignments, okay? Create a drug card. That is your activity for your hands-on learning activity for week 4 for maternity, okay? So any of those drugs that we talked about, oxytocin, magnesium, terbutaline, betamethasone, doesn't matter, anything. All right, do your drug card based off of that. Now, I want you to use the drug card template that I have for you guys. So that first line that says click here for drug card template, click where it says here to access the PDF download. You can download it and do it digitally or print it out. That's the one that kind of resembles like a Twitter profile, and it's called, has a new name for it too. I can't remember what it was. I think it's literally called like farm cards, something like that, child. And then so after you print out the template or download it to your device and use it and create your drug card, you want to submit it to that second link that says click here to submit. All right, once you submit that to me, you will have done your activity for this week, so you can get your extra giveaway votes. But yes, so I just wanted to tell you guys about that one. Next thing, all right, now that we talked about postpartum assessment, very quickly, let's do postpartum complications. Okay, then we're getting to newborn assessments. Postpartum complications. This isn't really a mnemonic because I don't really It doesn't really say anything, but mute heap, MUUTHEAP. If you have my maternity study kit, go to page 26, right below where it says veal chop, and look at the mnemonics that I have for postpartum complications. All right. So for MUUT, M is for mastitis. Okay. U is for URI, or upper respiratory infection. U is for UTI, urinary tract infection. T is thrombophlebitis. Okay, so that's for mute, or MUUT. And then HEAP, or HEAP. H is for hematoma. E is for endometritis. A is for abscess formation. And P is for perineal cellulitis. Ooh, Jesus, that sucks. All right. Did I give a mnemonic for magnesium sulfate? Let me go back to it. Did I? For magnesium sulfate toxicity, I gave the mnemonic burp. For magnesium sulfate toxicity, I gave them the mnemonic burp. BURP. BP decreased, urine output decreased, respiratory rate decreased, and patellar reflex absent. And remember that the antidote to magnesium toxicity is calcium gluconate. Okay? Let me see what else I was saying. I know, right? The way that the NCLEX was, it was like the more questions you get right, the less questions of that content area that you get. So like after I got my minimum questions of maternity, it quickly went to like select all apply, or something that I so clearly sucked at. But it's okay because she still passed in 75 questions. And that's all that matters, period. All right, so those mute heap, those were your postpartum complications. And for those, besides mastitis, and that's just inflammation of like the breast ducts, everything else you would use regular nursing interventions where you would see that otherwise. So depending, like your urinary respiratory infection, teaching them about like deep breathing techniques so they don't get like not aspiration pneumonia, but like or just pneumonia period from not exercising their lungs. Like it's those type of nursing interventions you do. For anything that's like any infection, you want to do things like monitor for signs of infection, monitor for worsening, monitor for signs and symptoms of like septic shock. So those things that you still want to do, those are just complications that, yes, you can get after being postpartum, but those complications are not specific to being postpartum. Okay. So that was that. Now let's get into our 4 causes of postpartum hemorrhage. All right, this one's a little easy because it's the 4 T's. All right, the 4 T's. These are the causes of postpartum hemorrhage: tissue, tone, traumatic delivery, thrombin. Okay, we talked about checking fundus. Tissue, as in retained placenta, because remember, after you birth the baby, you got to birth that placenta. And you have to, obviously, like they're assessing, well, after the birth of the placenta, as the nurse, you're assessing to make sure that the entire placenta is out. Okay, make sure it didn't like break off or leave some remnants inside, because that can cause a whole heap of issues. Okay, so tissue is retained placenta. And that could be a cause of postpartum hemorrhage. The next T is tone. So uterine atony. Remember I was telling you guys about assessing the firmness, I guess, or the tone of the uterus, whether it's boggy or not. Boggy or firm. All right. The other T is traumatic delivery. words mean things. You can kind of let that one speak for itself. Traumatic delivery. And then the other T, the last T, is for thrombin. Okay, so coagulation disorders. For example, like DIC. DIC is something you'll definitely learn in like the blood section of the hematology chapter of like med-surg. But DIC is disseminated intravascular coagulation. Okay, that is basically when abnormal clumps of blood clots form inside the blood vessels, and those clots use up all the clotting factors. So what that causes is just massive bleeding within your body, literally from every like orifice. Like you're bleeding from your nose, your eyes, because those blood clots have taken up and used up all your clotting factors, and so your blood can't clot. So you're just gonna massively bleed and hemorrhage out. Hence why that is a T for postpartum hemorrhage. Okay, so remember that. Tissue, tone, traumatic delivery, and thrombin. Okay, DIC is just an example of a thrombin disorder or a coagulation disorder that can cause postpartum hemorrhage. And then let's talk about our newborn assessment. Our neonatal vital assessment. Okay, so first of all, remember that when you have a newborn vitals are different from non-newborn vitals. Like, it's definitely different from adult, but it's different from like just normal peds child vitals. Newborn vitals have a specific set, so just make sure you're familiar with the newborn vitals. Okay, now as far as the newborn assessment, you'll probably be familiar with the mnemonic APGAR, APGAR. Okay, that's your neonatal vital assessment. So as soon as that baby comes out and they take it over to the little the incubator with the light and all that great stuff. Speaking of incubator with a light. Yeah, sure, I'll say this now. Jaundice in a newborn. Is that normal or abnormal? Jaundice in a newborn. Is that normal or abnormal? Answer right below. Jaundice in a newborn, like in a fresh I said newborn, so that should be a hint enough. Is jaundice in a newborn normal or abnormal? Jaundice in a newborn. Sweet Precision says normal before 24 hours. Saran Carly says abnormal. And see, Rose says abnormal after 24 hours. Miss Denise Trump says normal. So it's normal before a certain time, before that 24 hours, I believe. I'm going to just double check just to make sure. Jaundice. Okay, so that it's called neonatal jaundice. All right. It is common, and I definitely see this. Like, I come across this question often when I'm doing NCLEX Jeopardy. Because once again, a big thing for studying tips for maternity, you have to know what's normal versus abnormal. Okay. Neonatal jaundice is common and usually harmless. Okay, it's jaundice, so it's obviously yellowing of the sclera, which is the white of the eyes, in the skin and mucous membranes. But the But jaundice within a neonate, within those first 24 hours, that's normal. Okay. It's usually just due to like an immature liver. So that's why like it's common. They're fresh into the world. Maybe all their parts hasn't like woken up just yet. So intervention wise, what's usually done, make sure you know this as well. Because I remember this being a select all that apply question. With neonatal jaundice, after you assure mom and or dad that that it's normal within the first 24 hours and common, all right, then intervention wise, you're usually going to put them in like light therapy, like not a crib, but like a bassinet with its own like special like phototherapy, light therapy, to help resolve those cases and to speed it up. Because usually it resolves on it's own. Say that. Usually it resolves on its own without intervention. You just got to monitor it. But if it still lingers like days after, then light therapy is definitely needed. Okay. Hold on. Another thing, that neonatal jaundice, there's another name for it. Neonatal, I won't say that. Okay, I won't say that. Okay, neonatal jaundice is caused by an elevation in what lab? So what lab would the nurse expect to be elevated in a baby with neonatal jaundice? Okay, NC Pink Rose with the hyperbilly. Hyperbilly. Yes. All right, so Billy Rubin. Billy, y'all know Billy Rubin? Girl, I know Billy. Billy was just, girl, he used to have a crush on me in middle school. That damn Billy Rubin. Oh, I'm just kidding. That's how I remembered it in class. But yes, neonatal hyperbilly Rubin. That Billy Rubin is through the roof. Which, once again, that serum total serum bilirubin, that's normal within the first 24 hours. Usually resolves on its own. If not, into the light. Step into the light. All right. So let's get back to our APGAR. Okay, APGAR. It's a mnemonic. All right. The A stands for appearance. All right. By appearance, we're assessing, and we're looking at their color. Okay. Now let's pull up Billy Rubin that always with them. Yes, you know Billy too. You know Billy too. Do you know the Muffin Man? The Muffin Man? The Muffin Man. Who lives on Brewery Lane? That's Billy. Billy was his neighbor. That's cute. Hey, Patty Belts. What's up? What's up? All right. Like I said, let's get into APGAR. All right. So the A, we're talking about appearance, skin color. We're not talking about brown, black, white. We're not talking about that type of skin color. Okay. We're talking about appropriate for their race. Okay. So cyanotic, which means blue. Cyanotic / pale all over. Okay. All these different categories come with a score. So APGAR, this assessment is going to give you a score. And depending on that score, there's like different categories or different ranges like that will let you know the condition. That will let you know the condition of that newborn. Yeah. So, but we'll get into that. But yes, so the A for appearance, if they're blue / pale or cyanotic / pale all over, it's going to be 0 points. All right. If we see a person, whether it's a baby or Queen Elizabeth, whoever, if we see them with blue/pale skin all over, they are lacking what? They are lacking what if they are blue/pale all over? And if they are lacking that, then they're that baby's points, they're going to get 0 points. Okay? 0 points. They're lacking oxygen. Okay? So obviously the lower the APGAR score, the worse off that baby is. Okay? The higher the score, the better the outlook for that in that condition for that newborn. Okay? So 0, 1, or 2 points. Those are going to be the points that you get per category. So in appearance, for that first A, blue pale is going to give you 0 points. All right. If we know we have an oxygen issue to where a blue and pale baby, it's not looking good. 0 points. The next level up, which is 1 point. All right. That's going to give you like the body is going to be pink, but the extremities are going to be blue. This is also something as well. Let me see if y'all remember it. Hold on. Where only the extremities are blue. Hold on. All right. Y'all know what it's called? Do y'all know what it's called? Where that blue is only noted in the extremities. Y'all know what that's called? I'm about to cry. Acrocyanosis, absolutely. Acrocyanosis, it's often seen in healthy newborns, and it just refers to that peripheral cyanosis, once again in the extremities and also like around the mouth. It's caused by, it's benign, but it's caused by like a vasomotor changes within that vasoconstriction and increased tissue oxygen. Okay, so it's like it's a circulation issue, honestly. It's a circulation issue, but it is a benign condition. Okay. Yeah, that blood flow is just usually like very slow to go to the extremities. Okay. But yes, so if acrocyanosis is noted, even though it's a normal or a common finding, I'll say that, a common finding, they're going to get a 1. They're going to get a score of a 1. Okay. And then if the body or the parent's skin color is completely pink, completely appropriate, then they get a 2. All right. 2 points. 2 points for you. All right. So that's A. Now let's go to the P. That's for pulse. 0 points if it's absent. 1 point if it's below 100 beats per minute. And then 2 points if it's over 100 beats per minute. All right. Like I said, make sure you know normal range for newborn vital signs. Okay. The G stands for grimace. All right. That is, when they say grimace, they're assessing a reflex irritability. Okay. You're testing their response to like their reflexes, basically. 0 points if that grimace is floppy. Okay. 1 point if it's a minimal response to stimulation. And then 2 points if it's a prompt response to stimulation. Okay. And then A, the second A, or at least the second A is for activity. When you think about activity, you want to think about muscle tone. All right. All right. So muscle tone. If that muscle tone is absent, it's gonna get a 0 points. If that muscle tone includes flexed arms and legs, 1 point. But if that muscle tone is if that baby is active and there's some like well flexed and resisting like extension, normal and 2 points. Okay, but really the flexion is going to be what you're going to be assessing for. Do you have some flexion? Do you have no flexion? Like, is it just completely absent? Or is it active and appropriate in timing and reaction? What was that? A, activity? Yes. And then the R is for respiration. Okay? 0 points if it's absent, 1 point if it's slow and irregular, and then 2 points if it's a vigorous, healthy cry. Okay? So a good hearty cry, 2 points. Okay? So once again, anything that's like absent or they're really honestly absent, whether it's color, anything absent or 0 is going to get 0 points. All right? If it is a normal finding and shows like optimal condition, 2 points. All right? Anything in the middle, it's like not the best, but not the worst. It's like, porridge not too hot, porridge not too cold, porridge is just right. It's going to get 1 point. So yeah, that's your newborn assessment and your scoring system. Like I said, depending on the actual like score, all right, you will have a question where they're describing I guess they're describing the assessment of a newborn. So they're telling you the scores of the APGAR. So they may be like, no, they won't. They're not telling you the scores. You have to come up with the scores, really. They're telling you the assessment, and you have to come up with the scores. Not come up with, but you have to actually calculate the scores, and then see where that falls in the little like legend or key. So if they say like, you get a question, it's like, appearance is normal all over. Pulse is below 100 beats per minute. You have a few grimaces, but not all. You have active activity, full flexion, and then good crying. That is 2, 1, 1, 2, 2. So 2, 1, 1, 2, 2. 2, 1, 1, 2, 4, 6, 8. So that's 8. So that is 8. All right. So we know that the maximum score would be 2 points for each of the 5 categories. So the maximum could be 10. This particular example I just used got an 8 out of 10. Okay. So you would then use that 8 and kind of see where that falls in the like the condition scale. If it's 0 to 3, then the condition is severely depressed. If it's 4 to 6, condition is moderately depressed. And then if it's 7 to 10, excellent condition. We're at an 8, which falls between 7 and 10. So this newborn is in excellent condition. Okay. So that's really how you do APGARs. Yep, perfect. I feel like there was something that I definitely wanted to say. I already told y'all about the vital signs. We're gonna know reflexes, but then let's get to newborn assessment. Those lab values. No. And like I said before, and it's gonna be within the actual newborn assessment like chapter. Know what's normal versus abnormal, especially for a newborn baby. All right, so know what's normal, what should be what should fall in the category as normal, and when you're doing an assessment on the eyes, the ears, the nose, mouth. I mean, like I said, a full physical assessment know what's normal and what's not normal, what it looks like, and what those clinical manifestations will look like if it is abnormal versus normal. Okay, so these are all the things that you would be checking during your newborn assessment. Okay. That's really the big thing. Okay. Yes. Absolutely. Yeah, that's really the big thing. Yep. All right, so we talked about newborn assessment, postpartum assessment, and postpartum complications. Right? Okay, so tomorrow is Thursday. Yes, tomorrow is Thursday, which is going to be our NCLEX Jeopardy, but just like last week, or just all the weeks of our Back to Nursing School, so all the weeks within September, our campaign. Each time we did NCLEX Jeopardy, it was it focused or reflected the focus of that week. So our first week of NCLEX Jeopardy, first week of NCLEX Jeopardy of September was like nursing skills and basic skills. Second was cardiac med-surg / endocrine med-surg. And then this one's going to be maternity. All right, this is maternity. This is week 4. It's maternity. We did kind of like a pre-maternity one, like a pre-quiz, pre-assessment to kind of see where you guys were before we started week 4. And that I'm gonna look on those. Don't forget to do your pop quizzes as well. All right, you still can do your pop quizzes if you didn't do it. It's only 5 questions. All right, that's just gonna give you a little give you some help into figuring out which areas of the content you're like weakest in, strongest in, all that good stuff. And then tomorrow is going to be our like NCLEX style review game. We're going to take everything that we've learned and reviewed from all week, and we're going to put it to the test. All right, we're going to make sure that proof is in the placenta / pudding. Okay. Like I said, make sure you have your maternity OB study kits. Everything that I've went over is found within that study kit in just a little bit more detail. Like I said, do your pop quizzes and then do your drug cards, okay? I really want to see what you guys come up with for your drug cards. I did it on, you can either do it on that template, or if you want to do it on something else, do it on something else. But those templates are just something, like I said, for visual learners, for people that want to be entertained as they're studying and learning so that it can actually like stick and retain more. So that's why I gave you guys that free PDF template. All right. So we are done for tonight. Thank y'all so much for missing Married at First Sight for me, or it's still going on. Y'all can just rewind it. Thank y'all so much for joining me for part 3 of our live NCLEX maternity review. This is our last review part for maternity. All 3 parts will be uploaded to our subscriber only section. So if you guys have not subscribed, what are you doing? What are you doing? Okay, you're going to get all the live replays from this month, especially from this week when we focused on maternity. And you're also going to get subscriber exclusive content such as like daily NCLEX quizzes and maybe LPN like job posts, RN job posts, anything I see like that. And so yes, replay. If you guys want to catch this replay, you gotta subscribe. It's only $2.99 a month. Gotta subscribe if you want to watch this replay, take notes on it again, all that good stuff. Give you guys access, but you have to be subscribed. Okay. Do you know if the NCLEX is the same for US and Canada? I know the metric system isn't, so I'm not sure how else that applies to like the stuff in the NCLEX. But I know like measurement wise, it's different. And I know the scope of practice for like Canadian, I don't know if it's like RN or L, or they don't call them LPNs in Canada. It's like RPN or something. It's different. So I would just like make sure. Thank you. Woohoo! Good luck to all you guys that are studying for your NCLEX or for your finals, whatever. I hope that this was a great help. Black medical assistant Rock, did you see my message? Probably not. Send me another message. But yes, I hope this helped you guys. Let me know. Thumbs up if you came to either 1, 2, and or 3, part 3 of our NCLEX live review. And let me know if it helped you guys. If I should continue doing this with another subject, peds, another chapter within Med-Surg, fundamentals, let me know. Let me look at what y'all saying. I don't think. Okay, I think we're good. All right, y'all. I'm gonna let y'all go. I'm gonna go eat. Y'all go eat too. Make sure you guys download the Nurse Sam app. It's free to download. You have 25 NCLEX questions. I updated that, I think, at the beginning of this week. You can find the reviews in the subscription if you're subscribed. If you're subscribed, go to subscriber only lives, and the replays will be up there. The first 2 are already up there. Then when I finish this, and it's done, like analyzing and stuff, I'll send it there as well. Okay, the PI mnemonic was for preeclampsia. Okay, make sure you guys are paying attention to my posts on my actual Instagram profile. If you're subscribers, I sent some stuff to you guys as well, some practice questions, and some like exclusive content to help you guys. But for everybody else, I'm going to put some practice questions within my stories. You don't have to be a subscriber for these, but if you want more, you got to be a subscriber. If you want to watch this replay, got to be a subscriber. All right, so thank y'all so much. I will see y'all next time, or tomorrow. I will see y'all tomorrow at 7 p.m. Eastern Standard for Maternity and NCLEX Jeopardy. All right, bye y'all.